Today we'll study about screening and prevention part. So you must know that universal screening for preeclampsia is recommended. If I talk about the screening methods that are introduced by FOGSI, those are two methods: HDP gestosis score and multimodal screening. So HDP gestosis score, it was devised in India actually, and it involves assessment of existing and emerging risk factors in the pregnant woman using an objective checklist at the first and subsequent visits. And you can find HDP gestosis score on this link which they've provided in the guidelines also. So what is actually HDP gestosis score? It is a dynamic scoring system which can be done even by basic level healthcare worker in any setting. So what we do, it should be done at the first visit and preferably should be repeated at every antenatal visit until 32 weeks of gestation, or at least once in each trimester on an emergence of any new risk factor. It is actually accepted by National Health Mission India and is practiced routinely in many states. So in this score we weigh actually 27 clinical parameters including demographic factors, that is age, medical factors like chronic hypertension, autoimmune diseases, physical factors like BMI, MAP, and obstetric risk factors like previous history of HDOP or if she is a primigravida. If I show you the exact score, then these are the factors which have been scored as 1, like age older than 35, younger than 19, maternal anemia. So you can get this list here. And then there is a list for factors which have been assigned a score of 2. Okay, and then this is the 3, like the factors which have been assigned the score of 3. So you can see that the pregnancy with assisted reproduction, that is ovum donation or surrogacy treatment, they have been assigned a score of 3. Now see, HDP gestosis score is a 1 to 3 point non-invasive risk assessment tool designed by FOGSI to predict the development of hypertensive disorder of pregnancy or preeclampsia in pregnant women. So a cumulative score of 3 or more than 3 indicates high risk with 80 to 97% specificity for predicting hypertensive disorder. Okay, so this actually helps in early and targeted clinical management. So how is risk categorization done? If she has a score of 1, then it is a low risk; score of 2, that is moderate, and 3 or more is stratified as high risk. Now high risk patients, they require close surveillance, prophylactic measures, timely intervention to prevent maternal and fetal complications. So what are the prophylactic measures? It is actually these screen positive women based on HDP score, they have been recommended to start 75 milligram of aspirin per day as early as possible. It's not 81, it's not 150, it is 75 milligram aspirin per day. Okay, and it should be started as soon as possible and optimally before 16 weeks. So best is when if you started as soon as, then next best is before 16 weeks, and it can also be started up to 20 weeks with some clinical benefits. So compliance is important for risk reduction, like more than 90% of compliance. Then aspirin should be taken at bedtime. Duration of intake, aspirin should be continued at least till 36 completed weeks of pregnancy. This is also an important thing, that you should only continue till 36 weeks, because after that the timing of delivery is nearing and then there can be some slight risk of PPH and all. So only continue it till at least 36 weeks. So now the second screening method is multimodal screening. It is actually a multivariate assessment performed between 11 to 14 weeks, and it provides a risk score based on maternal characteristics, mean arterial pressure, uterine artery Doppler, mean pulsatility index measurements, and serum placental growth factor. So this is a complicated one, and the calculator is actually available on this site of on the site of FMF. Okay, this is the link. Depending on available resources, any of these methods may be used for preeclampsia screening. However, it is essential that preeclampsia screening be integrated into routine clinical practice. This is what is important. Then FMF guidelines, they say that the objective of screening at this stage is the identification of a group at high risk for preterm preeclampsia, that is less than 37 weeks. And they say that prophylactic use of aspirin, that is 150 mg per day, should be used. But this is all FMF guideline, FOGSI says 75, so let's stick to that. Okay. Now, other preventive measures are calcium supplementation, daily supplementation with 1.5 to 2 gram of elemental calcium. So this dose is also important. Okay, vitamin D, actually current evidence for vitamin D supplementation for preventing preeclampsia is weak, but there is a high quality data which is still pending. A practical regimen of 1000 to 2000 IU oral vitamin D per day is recommended. Okay, yeah.